An all-party panel of MPs is calling for a national strategy to improve palliative care and prevent elder abuse and suicide. And they say what's needed is more leadership from the federal government to make it happen. The Parliamentary Committee on Palliative and Compassionate Care heard from Canadians across the country. Its report today highlights the uneven level of services to an aging population. I spoke with two members of the committee about their findings and their recommendations. Frank Valeriote is an Ontario Liberal MP, and Harold Albrecht is an Ontario Conservative MP. Both were co-chairs of this all-party committee. Thank you for coming in. Good to see you. Joe Colmartin was another co-chair. Couldn't be with us for this conversation. He's off to Edmonton to talk about the findings of your committee there today. So you looked at the level of care when it comes to palliative care. You talked about elder abuse. You talked about family caregiver support and suicide prevention. So perhaps the best way to address your findings is to sort of work our way through them. And let's start with the issue of palliative care. Your report talks about how uneven the palliative care resources are across the country, and to that end, you talk about the need for a national palliative care secretariat. What would it do, Frank Valeriote?
Well, we're hoping that the secretariat would bring together the resources that are necessary to really implement some of the strategies that we've recommended in the report. Identify areas where there is no palliative care offered, for instance in Aboriginal areas or in a lot of rural areas. And you'll find certain areas in Toronto where palliative care is available and not in other areas of Toronto, and similarly in Montreal. Palliative care to deal with end-of-life issues is so important, and yet it's just they're in silos across the country, and we need to have a more consistent approach to it, especially with our aging population as it is.
I was going to say, Harold Albrecht, with an aging population, I think if I've got this right, your report points out that it's somewhere between 16 and 30% of the population or so that has access to this kind of care. Did that surprise you?
Well, it is surprising, and I think that's one of the things that both Frank and Joe and I learned as we went through this process. We brought in witnesses from across Canada. We traveled across Canada to get input from Canadians, especially in these fields of study. And it was quite surprising to see some of the findings that did come up. But I think Frank makes a good point in terms of the access in rural areas. We have to make sure that those who wish to return to their homes or to a spot closer to home from, in some cases, actually an acute care hospital, where they're being cared for at a horrendous cost, we can provide better care, lower cost care, more personalized care, either in their home or in a long-term facility or a hospice or something of that nature.
Now, let's also talk about elder abuse. How big of a problem is that in this country, and how do you think we need to deal with it?
It's growing, and you know, the proportions are much bigger than I think the research shows. The research shows somewhere between 4 and 10% of seniors will suffer from elder abuse, but others out there are saying it's more like 20%. I found that 20, 30 years ago when I was involved in spousal and child abuse, that the frequency of reporting is very low, and that's because those that are being abused are so dependent and so vulnerable that they're afraid to report. And the other thing is that people don't have the tools to identify when it's happening, just as it was 20 or 30 years ago when there was abuse going on against spouses or children. So we want to tool people with all of the necessary strategies and things that they'll be able to identify when it's happening. For instance, for all the frontline workers like police and firefighters and doctors and nurses and all of those people, so they can identify it, maybe bring up the subject and direct them to the resources that we need to make available to stop it and intervene in an effective way.
So what you've called for is the creation of an abuse awareness and prevention office through the Minister of State for seniors.
Correct.
Who would deal with these issues and
develop a strategy, a national strategy.
Right. Again, are you surprised? I mean, should Canadians be surprised to know there does not exist a national strategy, that there is no sort of coordinated approach to an issue that you believe is growing in society, Mr. Albrecht?
Well, I think it's certainly true, not only in the issue of elder abuse, but as you know, the area that I particularly focused on was suicide prevention. Here's another area where, like elder abuse, we have multiple groups on the ground doing good work in communities, sporadically. It's a patchwork. And what we need in elder abuse issues and in suicide prevention is just have some vision from some leadership at the national level to give resources, to bring research out of the lab into the front line, where those who are working and have been working diligently, all volunteers, so they can have the access to resources that will help them do their job better.
Let's stay with the suicide prevention strategy. You're calling for that, a national strategy, a national approach. And yet you heard in your hearings, and we heard at your news conference that, in fact, a strategy has been in place. The nuts and bolts have been there for probably a decade.
Well, only in the case of a volunteer group. The Canadian Association for Suicide Prevention has established a blueprint. It's a totally voluntary organization working with all volunteer people across Canada with very limited resources.
Right, but a lot of that blueprint's actually been adopted in other countries that have used it, but not here.
And that's why at this point, not only this particular report, but also my Bill C-300 is asking government to provide, again, as I said earlier, some national leadership, some coordination of resources so that we're not duplicating, and also so we're not missing a key piece that another jurisdiction may in fact have found is working well.
And there appears to be support from all members of the House, because the Liberals put forward a motion, an op-ed day a couple of weeks ago, and Bob Ray had presented, and in fact we received unanimous support to create a national suicide prevention strategy. So I think we're probably more hopeful on that than probably anything else in the book.
On this issue, we heard earlier this week from the Royal Society, an expert panel from the Royal Society, suggesting that the time has come in this country to legalize assisted suicide, legalize voluntary euthanasia. Now, I don't know that you dealt directly with that in your hearings, but as two MPs who were part of a large number of MPs who looked at this issue, where should this conversation go in this country now?
Well, our primary focus was improving palliative care and suicide prevention along with elder abuse issues. So it would be counterintuitive for an initiative that is trying to prevent suicide for us to delve into whether or not assisted suicide should be studied. So our focus was clear. We want to improve palliative care across the country, and we want to implement as many preventive measures to prevent suicide as we can.
Peter, I've talked to people who intend to take their lives later in life. The reasons they told me are fear of suffering from pain with no pain management facilities, a feeling of irrelevance and a lack of meaning in their life, and feeling like they're a burden on society. And our effort is to take and deal with those issues, introduce pain management systems, and in fact maybe even have governments consider the right to live pain-free as a human right.
And that came up in your report today as well.
That's right.
Again, a very uneven administration, application of pain management across the country, which you cite as a weakness of the system as well.
Pain management, even education for healthcare professionals in terms of the amount of training they're getting to adequately mitigate that pain.
Okay, so let's finish on this. A lot of these proposals certainly have costs attached to them. In a time when healthcare is coming up for renegotiation, healthcare court is coming up for renegotiation, and money is tight. How do you reconcile those two things? The demand for more services, more funds in a time when money's tight?
Well, some of them are far less costly, like having an abuse secretariat through the Minister of State for seniors. It could be we've figured it could be a couple of $1 million at best to have an office open and try and coalesce all of the information and bring all of these different networks that are out there together and help them, and fund them and help them with the tools that they need to deal with the issue of elder abuse. Similarly, I think with the national strategy on suicide prevention.
Right, and we're fully aware, we're not naive enough to think that all of these recommendations can be implemented quickly, but our hope is that step by step there will be parts of this report that will be adopted by all levels of government. This is not speaking specifically only to federal government. There are recommendations in here for provincial and other levels of government to implement. So I think we have the framework here for forward movement. We already see some movement on some of those issues. For example, the recent budget included some funding for palliative care models. And so I'm hopeful that as we progress through this, we'll see increasing buy-in by all levels of government and even community groups.
Well, you spoke about buy-in. Let me just finish on this. Our viewers and people who follow politics are treated to the partisanship a lot, but we should point out that we said again Joe Comartin couldn't be here from the NDP, but this is one of those examples where MPs, and many of you, not just the two of you or the three co-chairs, but many MPs from all parties participated in this process on a very important issue to Canadians. And how did that feel?
It's been a very good experience, and in fact, I said to Harold earlier, I said it's too bad that they didn't give us a few more issues to deal with on our own. We'd probably get them solved a lot better.
Could I just indicate just for a couple of seconds as to how this all started as far as my journey was concerned?
Sure.
I introduced a motion, M388, which dealt with internet predators back about two and a half years ago. After my first hour of debate, Joe Martin came across and sat beside me on my side of the House and said, "Good work, but we need to go further." And that was sort of the impetus for beginning on this. And I think, as Frank has said, we can cooperate on issues that we all agree have to move ahead. We may not always agree on the timing or what becomes the first priority, but we've laid out a framework here that I think will be helpful.
Well, appreciate you coming in and talking to me about it, and we'll see what happens to all your recommendations and see how far you can push them forward. Thanks for your time.
Thanks, Peter. Thank you.